Here's a segment from this month's edition of St. Charles Parish Today, a new monthly local talk show. Though last year's healthcare debate is now far removed from the headlines, one local group is continuing to raise awareness about the uninsured in our community. The River Parishes Coalition uses local organizations and agencies to match the uninsured with resources that can help. With me is Julia Budden of the St. Charles Community Health Center and social worker Joe Carr to talk about the history of the coalition and an important upcoming event. Thank you both so much for being on the show today to talk about this important subject. Can you explain a little bit about what the River Parishes Coalition is and how it got started?
River Parishes Coalition is a group of healthcare professionals, educators, faith-based organizations, individuals, and nonprofit organizations. It got started in 2010, July of 2010. St. Charles Community Health Center was granted a contract from the state to provide outreach through the CHIP and Medicaid program. As a result of that, the River Parishes Coalition was developed.
Okay, and you mentioned LeChip for our viewers out there that may not know exactly what that is.
LeChip is insurance for uninsured children in the state of Louisiana. There are also a Medicaid program for uninsured families. So it's still a CHIP program, is for children from 0 to 19.
Okay, you talked about ways to insure those children who may be uninsured at the moment. What is the extent of that issue here in the River Parishes?
We have a very large percentage. As the River Parishes Coalition, and let me just mention this, cover St. Charles Parish, St. John, and St. James. In St. Charles Parish, the number of uninsured children is not as great as in the other parishes. In St. Charles Parish currently, there are 9,000 plus children who are currently covered with through the LeChip program. Okay. In the other parishes, the numbers are not as great, but with the outreach that we're doing through the coalition, we certainly hope to reach as many children as we can.
Okay. What can the community do to help remedy the problem, and what resources do you think are needed in order to help the issue?
Well, I think the community can become aware of the program, the health insurance program, to become aware that there are uninsured individuals in the community whose lack of access to health care creates a higher level of expense for the community. Literally, more dollars have to go out because people are not obtaining prevention or early intervention services. In addition, I think it's difficult at this point for us to understand exactly what's needed. And so where we're beginning with this is a parallel effort to recruiting kids and adults by looking at what is available and getting that information in a central place and being able to maintain accurate information about where those resources are, what particular services they offer, how to get in touch with them, what the eligibility issues may be in that situation. Once we have a much better basis on which to understand what's already available, then I think we're in a position to do two things. One is to begin to engage with the agencies that are in a position to supplement the resources themselves. And the other thing is to maintain that kind of information and make it available to the community. It's not just healthcare. We're also looking at human services that promote people's ability to be aware of their health-related issues, and to get out there and take action to improve their health, thereby improving neighborhoods and communities.
Okay. So a lot of viewers probably who are watching this are very familiar with what the Community Health Center does.
Yes.
How are they involved in this particular initiative?
As I mentioned, in July of 2010, St. Charles Community Health Center was awarded a contract from the state through the Department of Health and Hospital to provide the service. Since we are a healthcare provider, the match was perfect. Because of the Legit Medicaid program, we are providing the community more resources in addition to healthcare. So St. Charles Community Health Center, as many of your viewers may know, we provide healthcare in St. Charles Parish, Jefferson Parish, St. Bernard, and St. Tammany parishes. Our service is unique because one of the things we do for the individuals who are uninsured, our fees are based on a sliding fee scale. So many of the individuals who are eligible for LCHIP or Medicaid, many of them are our patient. So because of this, we felt it was important for us to become a part of that. And not only St. Charles Community Health Center, but also get other agencies who were providing resources in the community to be a part of it.
Right. Okay. So you mentioned in the future that this is basically going to be kind of a referral service for people to get more information about how these programs can help them. Is there a number or a website that they can go to currently to get what information you do have?
Yes, they can contact myself, Julia Bowden, or Cherie Wilson at St. Charles Community Health Center, and that number is 985-785-5830.
Very good. Is there any upcoming events having to do with this issue or anything else you'd like to add?
We are looking possibly in the fall to do a prayer breakfast with the faith-based community. One of the things we realized that with our mission, that the pastor will be able to help us implement this program. And as a result of that, we would like to bring them on board.
Okay. Is there anything else you'd like to add?
Well, the pastors will help us to reach the folks that go to church, and they in turn can talk to their neighbors and other community members, grandchildren, siblings, sons and daughters, to spread this out on more of a grassroots level. Recognizing that sometimes folks don't keep up with what may be in the newspapers or necessarily even television. I think the other thing here is that probably we're going to move, at least initially, more toward prompting the community to develop the resource information availability for callers, folks who are looking for this. There are a number of agencies that are doing this in various ways. And I don't think it's so much our purpose to take that over as it is to help bring all of those folks together in a way that the community can actually relate to more effectively.
Right. Okay. Well, thank you both very much for coming on the show today, and we hope to see some more information out there about your coalition very soon.
We'd like to come back. Thank you.
Thank you. Catch the entire episode right here on Channel 6, daily at 5 p.m. or watch anytime at scptoday.com.